Thank you. It's a pleasure for me to be here with all of you and to face this complicated issue about mental health in children and adolescents in this phase of pandemic. Mental health is a complex aspect of overall well-being of individuals. We can have health without mental health, we say in WHO statement. It is the product of a variety of factors, both psychological and social, and its evolution affects both personal and interpersonal sphere. Furthermore, by acquiring information and living positive or negative events, the path of life means that each individual, since birth, carries with him a set of notions that shapes from moment to moment the mind, and as a consequence, it influences our mental health. This is greatly amplified in the phase of life transition, such childhood and adolescence. We studied as a psychologist, psychiatrist, this area for many years, but we had so many information now that we have to change our approach to see how we can face the different problems of mental health. Adolescence today, more and more precocious, is in fact by definition a period which is marked by the search of one's own identity, in which the search of the approval of peers plays a fundamental role. In this period of transition, young people try to create interpersonal and social relationships and to occupy a role within society which will in part define their future. During this period, concern and dissatisfaction with their own body image also emerge, while trying to conform to the standards of beauty of the society in which they live. This can cause them a certain discomfort, both when they fail in this attempt and when they engage in risky behavior to achieve it. This is particularly relevant in the new generation, the digital natives, considering that in addition to the physical space in which they move, they are additionally digital ecosystem to which they belong. Within this environment, canons of acceptance and reference to be respected in order to fully belong to the different community. All these aspects, which on one hand allow them to experience social and personal enrichment, often erode their sense of self-worth. This continuous performing, while trying to show the best part of themselves, risk undermining the self-esteem and psychological well-being of young people, especially when, despite effort to appear perfect, there's not the approval of peers, measurable by the numbers of likes obtained. This reaction of lack of recognition can also result in acts far more serious, such as cyberbullying and speech and non-consensual publication of intimate material, sexting, grooming, and other. These acts have a huge impact of the mental health of young people, considering that their dignity and social standing, both online and offline, is completely undermined. Furthermore, knowing that children and adolescents often hide this feeling of shame and lack of self-esteem, or if expressed, or often misinterpreted and misunderstood, thus remaining often held inside without a solution. The deteriorating mental well-being of children and adolescents around the world precede the COVID-19 pandemic. There are several studies that show the alarming data of mental health of children and adolescents around the world. And despite several appeals on this issue from national and international organizations, there still persists a lack of implementation of action and policy to safeguard the mental health of young people. Already in 2019, it was found that about 20% of adolescents worldwide experience mental disorder, considering also that half of young people have symptoms of mental disorder before the age of 14. In addition, 3 out of 4 adults' mental health problems begin during childhood and adolescence. This data about UNICEF 2021. Among the leading causes of health disorder in youth or behavior disorder, excessive alcohol use and drug use, and mental health disorder, a persisting finding over the year is that of suicide ranked as the 4th leading cause of death among youth aged 15 to 19. In addition, a CDC study in the United States shows that more than 1 in 3 high school students say they had experienced persistent feeling of sadness or discouragement in 2019, such that they were unable to participate to their regular activities, a 40% increase since 2009. Such sentiments are also fueled by the increasing use of social media and platforms. Since before the pandemic, online communities have often acted as trigger, even encouraging harmful behaviors. Mental disorders are also associated with exposure to online risks, such as cyberbullying, exposure to age-inappropriate content, and hate speech. It is often the algorithm of some social media that make potentially harmful content more accessible, such as pro-suicide, pro-anorexia, and pro-bulimia sites. However, it must be emphasized that it is not the time spent online that causes mental health problems, but it's the excessive use of such systems, which significantly interfere with daily activities such as sleeping, eating, and socializing with family or friends. It's not the time, but it's the quality of the time that the children and adolescents use the platforms. A vulnerable category, both in the offline and online environment, is the group of young people already suffering from mental disorder or more. Children and adolescents with a prior history of mental health disorder often suffer from the stigma associated with the mental suffering, isolation, and discrimination, and are more vulnerable to further risk and violence, both in the physical and virtual world. The combination of social and economic factors, such as household structure, educational background, pre-existing mental health condition, example, children with special needs, being economically disadvantaged, or personal and family experience with one or more disease, and the pandemic significantly amplified its effect on the individuals regardless of their age group. Undeniably, the containment measures adopted by governments around the world to counter the spread of COVID-19 have radically disrupted everyone's daily life, with implications in the economic, social, and psychological sphere, exacerbating pre-existing problems. This is true not only for adults, but also for children. In fact, children seem to be mostly spared from the virus, or if they are affected, in most cases, the symptoms they present are mild. The issue is totally different if we consider psychological well-being. The health emergency has changed the context of life of children and young people, leading to the closure of school. From the end of February in Italy 2020 until the end of the school of the last year and in this year, and the introduction of distant learning, confinement to their homes, the impossibility of having contact with the presence of their peers, and the suspension of all extracurricular activity. These restrictive measures have created abnormal as well as unexpected developmental conditions for adolescents. The social rules that all of them were asked to follow are completely at odds with the natural urge in this phase of the life cycle in which the person is strongly involved in exploring the external world in the search for autonomy and new experiences, in the construction of meaningful relationships outside their family of origin, in the attributing importance to value such as willingness to change, in the exploration of projects for the future, and not least in the construction of the renewed awareness of their bodily identity. Confinement within one own home, in effect, to consider in several respects. While many studies show that home confinement has provided space for strengthening of interfamilial relationships, confinement at the same time could exacerbate previous events of violence perpetrated by the circle of trust. Direct exposure to one's perpetrators has increased in case of unreported domestic violence have been quite a concern, both from women and children. This case in particular has protracted mental health consequences for children and adolescents. Adolescents in particular have rarely been in the focus of specific attention and intervention during this particular period of time. This is undeniable that the consequence of restriction include increased level of anxiety and depression, altered sleep-wake rhythms, feeling of loneliness, irritability, boredom, but also symptoms referred to post-traumatic disorder. One study compared two representative samples of children and adolescents from 18 to 18 years old before COVID-19 and during lockdown, and found that participants exhibited more severely anxiety and severe sleep-related disorder during lockdown than before COVID-19. The data obtained from a listening and counseling center framed the ongoing mental health condition of the new generation. According to Child International, in 2020, there were a total of 50,176,000 calls made to helplines. Of those 50 million calls, 30.6% of contacts were due to mental health issues, including fear and isolation, suicidal thoughts, and behavioral issues. In addition, 12.8% of calls instead requested support in accessing service ranging from essential goods to legal support. Approaching to the European landscape, 1 in 3 children contacted helpline for mental health-related reasons. Researchers and mental health professionals expressed particular concern for children with previous mental illness, whose lives many have been severely impacted by restrictive measures. The UK charity Young Minds in 2020 surveyed adolescents with psychiatric disorder, and 83 of them reported their mental health deteriorated. Moreover, in a further study conducted in Turkey in 2020, children and adolescents aged from 6 to 18 years, with a previous diagnosis of obsessive compulsive disorder, reported an increased frequency of contamination, obsession, and cleaning, washing compulsion during the pandemic period. In spite of the questions raised by the scientific reading concerning the side effect of COVID-19 pandemic from a psychological point of view for young people, the study conducted are quite numerous, even in those that specifically focus on adolescents, or very few number. I have to say that the research in this area is very immature. We have a very few papers with the methodology of research is still very weak. Moreover, to date, it appears difficult to draw unequivocal conclusive indication from the literature in general on the psychological effect of the pandemic, since the time span is marked by alternating phase of opening and closure. Therefore, the results necessarily refer to specific phase considering and longitudinal study or really scarce. Beyond this limitation, the picture that emerges is anything but encouraging. While adolescents are shown to be more responsible, as the personal motivation led them to follow the rule of social distancing in the first lockdown out of a desire to protect others, and resilient, and the pandemic condition led them to discuss more with family and friends about mental health. In general, the studies show a situation of generalized malaise. It can be concluded by setting out the COVID-19 pandemic exacerbated an already existing condition of distress and malfunction of worsening mental health of children and adolescents, which had been progressing for a decade, joined also by a persistent lack of attention and specific intervention by designated institutions and structures. How can the mental health of children and adolescents be improved? The overall study conducted until now lead to several actions to carry out in the near future. It is essential to provide some indication that can guide intervention aimed at strengthening resources, reducing the negative effect of the pandemic, and taking care of today's adolescents. In fact, the damage caused by the pandemic can be mitigated if targeting and timely intervention are put in place. Starting from the situation of discomfort and suffering of children and their own observation, it is necessary to create support networks that cross the various ecosystems to which children and adolescents belong. What is needed is the implementation of a map of connection and service with schools to service that can identify themselves as point of reference while welcoming and listening to discomfort. It is essential to strengthen those services that make the school a context of taking care of the adolescent at 3,600 degree, starting from the essential collaboration between parental and educational figures, including moments of confrontation, passing to service useful for the orientation of young people in the later stage of the study or work, arriving up to listening and reception service, such as school psychology service, for which much had been done in recent years, but much remains to be done so that they are accessible to in all schools. Among the more institutional action, there is the need to develop child mental health policy, implement prevention and early intervention strategy from transition age youth, and reduce disparity in providing mental health care. Strengthening the network service with the involvement of all professionals and institutions of reference, and investing in periodic training and developmental of skill of health and social workers, including on mental health issues, will provide comprehensive service, integrated and able to respond and take charge of the territorial level. In order to implement the above-mentioned measure efficiently, it is essential to intercept these children and their needs at the early stage, identifying new model of care that take into account their language and their needs. Young people must participate in decision-making and policy-making process, since they are the recipient of this future proposal. A great opportunity is also provided by the digital channels in terms of wellness promotion, prevention and diagnosis and evaluation, caretaking, but also for research. In particular, the closure of service during the pandemic led to a suspension of traditional care and caretaking pathways. This brought out strongly the need of implement new intervention through digital technologies. Digital psychiatry and telemedicine are promising methods when working with young people, precisely because they're accustomed to using digital devices on a daily basis. Some children and adolescents even seem to prefer telemedicine to the traditional therapy because they see it as more of a game. Talking through the screen also makes them feel less judged. It is also important to consider how to help kids to the platform they use most. Among the most innovative ideas is the construction within the new digital ecosystem, the metaverse of listening and support center, in order to make every environment, both physical and virtual, a place that protects children and adolescents and their experience. In conclusion, to implement a better approach to improving the well-being of children and adolescents, it's also necessary to think about a near future where COVID-19 will no longer we consider an emergency. From this experience, we have learned how crucial it is to listen to the needs of children themselves, to understand, including through their needs, what action needs to be taken to safeguard their mental health. Children and adolescents must be protagonists in this decision that will affect their lives, actively participating in the decision-making process. The participation must be a constant feature of all measures and policies that affect the well-being of children and adolescents. Thanks.